Hi. Welcome to your Home Health Aide Training Course Module 1, Introduction to Home Care. You're about to embark on a truly meaningful career path. As a home health aide, you won't just be performing tasks. You'll be a vital source of comfort, support, and dignity for individuals right in their own homes. This role offers unique challenges, but also immense rewards, allowing you to build personal connections and make a real difference every single day. In this first video, we're laying the groundwork by answering a fundamental question. What exactly is home health care? Understanding this core concept is your first step towards becoming an indispensable part of someone's care team. Let's get started. Let's begin by defining what we mean by home health care. Simply put, home health care is professional, compassionate support provided directly in a patient's private residence. This can range from medical services like wound care or medication management, delivered by skilled nurses, to essential non-medical assistance like help with daily tasks, light housekeeping, or companionship, which is often where you as a home health aide will come in. The core idea is to bring necessary care to the patient, preventing the need for frequent hospital visits or long-term facility stays. What's key to understand is that these services are highly personalized and tailored to empower individuals to live safely and comfortably at home. Every care plan is unique, built around the patient's specific health condition, personal preferences, and the needs of their family. Your role as an HHA means you'll be directly involved in providing this customized support, whether it's assisting with personal hygiene, preparing meals, or helping with mobility. It's about more than just tasks. It's about enabling a patient's independence and improving their quality of life within their most familiar environment. Now that we understand the definition, let's explore the core goals that drive all home health care services. There are 4 primary objectives that guide our work as home health aides. The first and perhaps most empowering goal is to promote patient independence. Our aim is not to do everything for the patient, but rather to assist them in doing as much as they can for themselves. This might involve helping them with exercises to regain strength, guiding them through daily routines, or providing tools that make tasks easier. Let me share a quick story to illustrate this. I once worked with an elderly gentleman named Mr. Henderson, who loved to read his newspaper every morning, but after a stroke he struggled to turn the pages. Instead of me turning them for him, which might have been quicker, we practiced using a special tool designed for page turning, and I helped position the paper so he could reach it. It took a little longer at first, and required patience from both of us, but within a few days, he was proudly turning the pages on his own. That small act, reading his own newspaper independently, meant the world to him. When patients maintain their independence, even in small ways, it significantly improves their quality of life, their self-esteem, and their overall well-being. It's about helping them reclaim control over their lives. Next, we focus on helping patients maintain safety and comfort within their home environment. This involves assessing for potential hazards, such as throw rugs that could cause falls, ensuring their living space is clean and organized, and making sure they have access to their medications and necessary supplies. Comfort also extends to their emotional well-being, providing a calm, supportive, and respectful presence. For example, I remember assisting Mrs. Rodriguez, a wonderful woman who lived alone and had recently become unsteady on her feet. She had a habit of leaving her walking cane by her armchair, which was just out of reach when she stood up from her bed. We worked together to establish a simple routine. Her cane would always be placed right next to her bed, easily accessible. We also cleared a pathway to the bathroom, removing a small throw rug that had caused her to stumble before. These small adjustments significantly reduced her fear of falling and made her feel much more secure and comfortable moving around her own home. Our role is to create an environment where they feel secure, at ease, and free from unnecessary worries. The third critical goal is to support recovery or manage chronic illness. Many patients receiving home health care are recovering from an illness, injury, or surgery. Our support can be vital in their healing process, helping them follow doctors' instructions, monitor their progress, and assist with rehabilitation exercises. Think of a patient named David, a younger man recovering from knee surgery. His physical therapist gave him specific exercises to do daily to regain strength and flexibility, but he found it hard to stay motivated and remember all the steps on his own. As his HHA, I helped him create a visual exercise chart he could easily follow. Each day, I'd gently remind him when it was time for his exercises, observe his movements to ensure he was doing them correctly and safely, and offer words of encouragement. This consistent, personalized support helped him stick to his regimen, leading to a much smoother and faster recovery than he would have had alone. For individuals living with chronic conditions like diabetes or heart disease, home health care helps them manage their symptoms, adhere to their treatment plans, and prevent complications, allowing them to lead fuller lives despite their ongoing health challenges. Finally, a very important goal of home health care is to avoid or delay institutional care. For many individuals, staying in their own home, surrounded by their memories and familiar routines, is incredibly important. Consider Ms. Eleanor, a lovely lady in her late 80s who deeply cherished her small garden and her beloved cat, Mittens. Her family was beginning to worry she might need to move into a nursing home because she was struggling with meal preparation and remembering her medications. With the consistent support of home health aides, who helped her with grocery shopping, cooked nutritious meals, and provided gentle reminders for her medication schedule, Ms. Eleanor was able to continue living in her cherished home. She could still spend time in her garden and have Mittens curl up on her lap every evening, maintaining her quality of life and independence in the place she loved most. Home health care provides the necessary support and services to make this possible, often preventing or postponing the need for them to move into nursing homes or other long-term care facilities. This allows patients to maintain a higher degree of personal freedom and quality of life. So to recap, we've explored the fundamental question: what is home health care? We learned that it's supportive medical or non-medical care delivered right in a patient's home, always tailored to their individual needs to help them live safely and comfortably. We also delved into the 4 main goals that guide every home health aide's work: to promote patient independence through gentle assistance, to maintain safety and comfort by creating secure home environments, to support recovery or manage chronic illness through consistent care and adherence to treatment plans, and ultimately, to help patients avoid or delay institutional care, allowing them to thrive in their own familiar surroundings for as long as possible. Understanding these core principles is absolutely crucial as you begin your journey. In the next lesson, we'll explore who receives home care, the types of individuals and families you'll be supporting, and the unique needs they may have. Thank you for joining me for this first segment. We look forward to continuing this vital training with you in our next video.